Good morning, everybody. We're going to talk about targeted temperature management today. Targeted temperature management is a protocol by which you lower the body temperature of patients who have suffered a cardiac arrest with neurological injury, presumably due to anoxia. In targeted temperature management, we typically bring the body temperature down to 32 or 33 degrees centigrade for about 24 hours with gradual rewarming and reassessment of neurological function. This started after a clinical trial in 2002 suggested better outcomes in terms of mortality and neurological function in patients who were treated with this protocol. A new study, however, came out in 2021, the TTM2 trial, which is linked in the description below, studied 1,900 patients with coma following cardiac arrest and judged their outcomes in a blinded way, meaning that the person assessing their outcome was blinded as to what treatment was provided. And they were assessed at 6 months for mortality and at 6 months for neurological function based on a Rankin scale. And turns out there was no difference between the treatment group maintained at a body temperature of 33 degrees and the placebo group that was maintained with normal thermia. The theory was that fever was bad for neurological function, therefore normothermia meant early treatment of fever. And at the end, as I said, studying 1,900 patients, which was far more patients than were studied in the 2002 trial, there was basically no difference, therefore no benefit from lowering the temperature to 33 degrees. So what becomes of targeted temperature management? The take-home seems to be that you should avoid fever, even though this trial did not really compare normal thermic management to just letting the temperature do whatever it is. This was based on a theoretical concern, but clearly there was no benefit from the hypothermia in a large trial, better done than the original studies. So in my opinion, there's really no role for targeted temperature management with respect to hypothermia in post-cardiac arrest patients. It limits your access to the patient, it limits your ability to provide care, it limits your ability to move the patient for other studies such as MRIs of the brain, etc. So there are delays, and it usually complicates nursing care as many of these patients are placed on one-on-one nursing at the time. So I think until further data is available, that targeted temperature management will be an interesting memory in the future. Thank you.